All right, so we've been getting a handful of questions about upper blepharoplasty, and the common thing that we get asked is upper blepharoplasty just a removal of skin? And the answer is it depends. Sometimes it is, and we call those a sliver if we're just taking a sliver of skin out. And depending on the patient's anatomy, that may be what's indicated. But sometimes patients have another issue that's below that. Sometimes there's a problem with a fat pad. There's a few different fat pads that sit under the skin. And if those are sagging or hanging or causing some obstruction of the upper eyelid or eyelashes, then those can cause some heaviness. And if you just take the skin out and don't treat those areas, then sometimes you're left with a result that's not quite as good as it could have been. And the other common thing that people mistake as upper eyelid skin is the brow fat pad. So the brow tends to sit above the rim of the orbital bone in women. And as we age, sometimes that brow comes down. And so there's a few different ways that we can address that brow. Sometimes if it's just hooded on the side, we can do something called a Pexy, where we take the way we stitch the eye closed at the corner, it actually kind of tightens up and gives that brow fat pad a little bit more support. It doesn't really lift it, it's not a brow lift, but it's done through the same incision. And so we do that at the same time as our upper blepharoplasty if we need it. And then sometimes, of course, some patients need a actual formal brow lift, which is a separate thing, usually involves incisions in the hairline. I think the important thing is that, like most things, upper eyelid surgery is not a one-size-fits-all. You need to see somebody and have them look at your eyes and make sure that they pick the right approach for you, and that's how you're going to get the best outcome. All of these can be offered fairly simply. Usually they're done under local anesthesia in our office. They're not a big deal. They just have to be done properly with a credentialed surgeon who does this frequently. So that's what I would say to answer that question. It's one that's come up a couple times this week and what we wanted to focus on in our video today.